Welcome to our channel, Systems. In today's video, we're exploring everything you need to know about sinus infections. Sinus infections, or sinusitis, can cause a range of uncomfortable symptoms like nasal congestion, facial pain, and headaches. We'll break down the common causes from viral infections to allergies and discuss how to recognize the symptoms. Plus, we'll share tips on prevention and treatment options to help you find relief. Stay tuned for all the details and make sure to like, subscribe, and hit the notification bell for more health insights.
Sinusitis is a common condition that affects millions of people. It occurs when the lining of your sinuses, air-filled cavities in your skull, becomes inflamed or swollen. This inflammation can make it difficult for your sinuses to drain properly, leading to a buildup of mucus and pressure. Sinusitis can be caused by a variety of factors, including viruses, bacteria, and allergies. It can be acute, lasting for a short period, or chronic, lasting for several weeks or even months. Understanding the causes, symptoms, and treatment options for sinusitis is crucial for effective management and relief. Let's delve deeper into the world of sinusitis to gain a comprehensive understanding of this prevalent condition. Sinusitis can be a real pain, literally. But with a little knowledge, you can take steps to feel better and breathe easier. Sinus infections can be quite bothersome, manifesting as a range of uncomfortable symptoms. Recognizing these telltale signs is the first step towards seeking appropriate treatment and finding relief. One of the most common symptoms is facial pain and pressure. This discomfort is often concentrated around the forehead, cheekbones, and bridge of the nose, intensifying when you bend over or lean forward. Nasal congestion, another hallmark of sinusitis, can make breathing through your nose a challenge. You may also experience a thick, discolored nasal discharge that drains down the back of your throat, a condition known as postnasal drip. Other symptoms include headaches, often focused around the forehead and sinuses, and a reduced sense of smell. If you notice these signs, it's essential to consult a healthcare professional for proper diagnosis and treatment. Sinusitis, the inflammation of sinus linings, can arise from various culprits, each triggering a cascade of discomfort. Viruses, the usual suspects behind common colds, often play a role in acute sinusitis, causing temporary inflammation. Bacteria, though less frequent offenders, can also infiltrate the sinuses, leading to more persistent infections. Allergies, another common trigger, set the stage for sinusitis by inflaming nasal passages and creating a breeding ground for germs. Structural abnormalities within the nasal passages, such as a deviated septum or nasal polyps, can obstruct airflow and mucus drainage, increasing susceptibility to infections. Immune deficiencies, whether temporary or chronic, can also weaken the body's defenses, making it easier for infections to take hold. Understanding the underlying cause of your sinusitis is key to effective treatment and long-term management. Sinus infections, often shrouded in misconceptions, can lead to unnecessary worry and improper self-treatment. Let's debunk some common myths surrounding this prevalent condition. Myth number 1. All sinus infections are contagious. While viral sinusitis, often accompanying a cold, can spread, bacterial sinusitis is less likely to be contagious. Myth number 2. Sinusitis always requires antibiotics. Contrary to popular belief, most cases of sinusitis are caused by viruses, rendering antibiotics ineffective. Myth number 3. Green or yellow mucus always indicates a bacterial infection. While discolored mucus can suggest an infection, it's not a foolproof indicator, as allergies and other factors can cause it. Myth number 4. Sinus infections are always short-lived. While acute sinusitis typically resolves within a week or two, chronic sinusitis can persist for months or even years. It's crucial to consult a healthcare professional for accurate diagnosis and appropriate treatment, avoiding self-diagnosis and unnecessary medication. Finding relief: home remedies for sinus infections. When those familiar sinus pressure and congestion set in, seeking relief becomes paramount. While it's crucial to consult a healthcare professional for diagnosis and treatment, several home remedies can help ease symptoms and promote healing. Nasal irrigation, a simple yet effective technique, involves flushing out nasal passages with a saline solution. This helps remove mucus, allergens, and irritants, reducing congestion and promoting sinus drainage. Staying hydrated is crucial for thinning mucus and preventing dehydration, which can worsen symptoms. Warm compresses applied to the forehead and sinuses can provide soothing relief from facial pain and pressure. Over-the-counter pain relievers, such as ibuprofen or acetaminophen, can help manage pain and reduce inflammation. These home remedies, combined with rest and a healthy diet, can significantly improve comfort levels as your body fights off the infection. When home remedies aren't enough, seeking professional help. While home remedies can provide relief from sinus infection symptoms, it's essential to recognize when professional medical help is necessary. If your symptoms persist for more than 10 days without improvement, worsen despite home care, or are accompanied by severe pain, fever, or vision changes, it's time to see a doctor. Seeking prompt medical attention ensures proper diagnosis, as other conditions can mimic sinusitis symptoms. Your doctor can determine the underlying cause of your sinusitis, whether it's viral, bacterial, or allergy-related, and recommend the most effective treatment plan. Delaying professional care can lead to complications, especially in cases of bacterial sinusitis. Remember, timely intervention is key to resolving sinusitis and preventing potential long-term issues. Navigating treatment options, from over-the-counter to prescription. Treating sinusitis effectively often involves a multifaceted approach, tailored to the underlying cause and severity of your symptoms. Over-the-counter decongestants can provide temporary relief from nasal congestion, while saline nasal sprays help rinse nasal passages and thin mucus. Pain relievers, such as ibuprofen or acetaminophen, can alleviate headaches and facial pain associated with sinusitis. For bacterial sinusitis, your doctor may prescribe antibiotics to target and eliminate the infection. In cases of chronic sinusitis or allergies contributing to your symptoms, your doctor might recommend nasal corticosteroid sprays to reduce inflammation. Understanding the various treatment options empowers you to make informed decisions about your sinus health. Preventing sinus infections. Tips for keeping your sinuses healthy. Preventing sinus infections involves adopting healthy habits that bolster your body's natural defenses and minimize exposure to triggers. Frequent hand washing, especially before touching your face, is paramount in reducing the spread of germs that can lead to infections. Staying hydrated by drinking plenty of fluids helps thin mucus and promotes proper sinus drainage. Avoiding close contact with individuals who have colds or other respiratory infections can minimize your risk of exposure. Managing allergies effectively is crucial, as untreated allergies can increase your susceptibility to sinusitis. This includes identifying and avoiding allergens, using appropriate medications as prescribed by your doctor, and considering allergy shots for long-term relief. Sinusitis in children. Special considerations. Sinusitis in children warrants special attention, as their developing immune systems and smaller sinus passages make them more susceptible to infections. Recognizing the signs of sinusitis in children is crucial, as they may not always be able to articulate their discomfort. Common symptoms include persistent nasal congestion lasting more than 10 days, thick yellow or green nasal discharge, cough, and bad breath. Children may also experience irritability, fatigue, and decreased appetite. If you suspect your child has a sinus infection, it's essential to consult their pediatrician for proper diagnosis and treatment. Prompt medical care can help alleviate symptoms, prevent complications, and ensure your child's well-being. Living with chronic sinusitis. Long-term management strategies. Living with chronic sinusitis, a persistent condition characterized by recurring or long-lasting sinus inflammation, often requires a proactive approach to manage symptoms and improve quality of life. Working closely with your doctor to develop a personalized treatment plan is essential. This may involve a combination of medications, such as nasal corticosteroids, saline rinses, and allergy medications, to reduce inflammation and control triggers. Lifestyle modifications, such as using a humidifier to add moisture to the air, avoiding smoke and irritants, and managing stress, can also play a significant role. In some cases, surgical interventions may be considered to address structural abnormalities that contribute to chronic sinusitis. Remember, effectively managing chronic sinusitis requires ongoing communication with your healthcare provider and adherence to your treatment plan. The bottom line: taking charge of your sinus health. Sinus infections, while common and often bothersome, can be effectively managed with a proactive approach to understanding their causes, symptoms, and treatment options. From practicing good hygiene to seeking prompt medical attention when needed, empowering yourself with knowledge is key. Remember, listening to your body and consulting a healthcare professional for accurate diagnosis and personalized treatment are crucial steps towards finding relief and preventing complications. By adopting healthy habits, managing allergies, and staying informed, you can take charge of your sinus health and breathe easier. Your sinuses play a vital role in your overall well-being, and prioritizing their health contributes to a healthier, happier you.